Now let's talk about the Child Development Team and early intervention. There is a focus on early intervention in New Zealand with the aim that early intervention provides better long-term outcomes. The Ministry of Education Special Education Division provides early intervention for children with a disability if they are eligible and if their disability affects their learning at home or in an early childhood education facility, such as kindergarten or play centre. The Early Intervention Service may be available to assist your child up until the age of 5 or shortly after. An assessor will observe your child at home and in their ECE or home learning environment to devise a plan for how their education needs can be met. There might be several therapists involved, including an early intervention teacher, psychologist or speech-language therapist. The District Health Boards in Auckland also have a child development service aimed at meeting the disability needs of the child under the age of 5. The Child Development Service has access to interpreters to deliver their service in a culturally focused manner. The types of professionals who may be accessed here include, based on eligibility, speech-language therapists, dietitian, visiting neurodevelopmental therapists, physiotherapists, occupational therapists, and social workers. The Culturally and Linguistically Diverse Service operates under the District Health Boards. This service delivers guidance and disability information and support and assistance to translation and interpretation services for speakers of other languages in Auckland. Waitemata and Auckland District Health Boards have cultural caseworkers of diverse cultural backgrounds. These caseworkers provide cultural support services and advocacy to help ensure appropriate allocation of support services to children and families of called backgrounds. They can have direct contact with families and assist them in home and clinical settings. County's Manukau District Health Board delivers a culturally and linguistically diverse disability information service via Disability Connect. We deliver some direct one-to-one support as well as running support groups for the Chinese and Indian communities. And we have also translated our popular Disability Support Guide into Chinese, Korean and Arabic. We have access to interpreters and have cultural disability advisors of Chinese and South Asian descent. Now let's talk about support groups, the NGO or non-government organisation sector, and the Total Mobility Scheme. An important factor in raising a child with a disability is to connect with other similar families to gain and learn new skills and contacts. New Zealand has a wide range of support groups aimed at youth with various different disabilities, as well as for parents of children with disabilities. Disability Connect can provide more information about this. There are many organisations in the NGO or non-government organisation sector, including Disability Connect. These organisations may receive some government funding, but are not government departments. Some NGOs are specific to certain disabilities, and some are broadly focused on a range of disability issues, such as Disability Connect. Contact us for more information about NGO organisations. The Total Mobility Scheme is a subsidised transport scheme operating throughout New Zealand with some regional variations. The scheme involves a taxi card which is presented to the taxi driver and entitles the disabled passenger to a 50% discount on a taxi journey to a maximum journey cost of $80. So the maximum disability subsidy is $40. If the journey is longer than this, the disabled passenger pays the balance themselves. This scheme is for people with a disability who has difficulty safely and independently accessing a bus, train or ferry, including getting to the place from where the transport departs, getting onto the transport, riding securely, getting off the transport, and getting to the destination. So it can apply to people with an intellectual or sensory disability, as well as a physical disability. There is also a mobility card. A mobility card entitles you to park in a disabled car park outside shopping areas or supermarkets. We're now going to talk about work and income supports. Work and income is a division of the Ministry of Social Development. They have a role in providing some funding support to people with a disability and/or their family. To access work and income supports, there are a variety of eligibility criteria, including, for example, that you must be a New Zealand citizen or permanent resident, although some supports are available to the refugee community. There may be a stand-down period for some applicants if they have lived overseas for some years. There is more information about work and income supports at this website. The most common supports from work and income in disability are the Child Disability Allowance, the Disability Allowance, the Supported Living Payment, and the Accommodation Supplement. The Child Disability Allowance is paid fortnightly to the main caregiver of a child or a young person with a serious disability in recognition of the extra care needed for that child. This support is applicable up to a maximum age of 18 years. The disability allowance is for people who have a disability and need help with everyday tasks and ongoing medical care. Consumable costs, such as making regular visits to doctors or hospitals, pharmaceutical costs, extra clothing, etc., may be relevant costs. Adults with a disability can apply for this, and it may also be applicable for children. The supported living payment is for individuals with a disability who are permanently and severely restricted in their ability to work or are unable to work for 15 hours or more per week in paid employment due to their disability. This is aimed at individuals 16 years and over. A different category of supported living payment is available for parents and caregivers of an individual with a disability. They need to be responsible for full-time caring for someone at home who would otherwise need hospital-level care or residential care, but not your husband, wife, or partner. The accommodation supplement may also be available for people with a disability over the age of 16, including those who live at home with their parents. This support is means tested and is aimed to address accommodation costs. We will now talk about the Ministry for Vulnerable Children, Oranga Tamariki, and Child, Youth and Family Services. Child, Youth and Family Service has traditionally been responsible for the care and protection of children and young people in New Zealand. In August 2016, Government announced the establishment of a new ministry called the Ministry for Vulnerable Children, Oranga Tamariki. This is the result of recent analysis of child, youth and family services and outcomes. At present, the Ministry for Vulnerable Children is operating alongside Child, Youth and Family, because this transformation will take some time to complete. The following information is about Child, Youth and Family Services and is relevant whilst these changes take place. This service is responsible for the care and protection of children and young people. Child, Youth and Family Services may be involved to assess a child's level of needs, including risk or harm. And Child, Youth and Family will work with the family and others to find the best solutions for the child. Child, Youth and Family may link you with community services, or, if there are concerns, a fuller assessment will take place and will link the family with targeted support. A family group conference may be held, where the family and other key people agree on a plan to support the child and family. In serious cases of risk, the child may be taken into care while Child, Youth and Family work with the family. Strengthening Families process. This service helps to coordinate support for families in New Zealand. There may be various professionals involved in the care of a young child with disabilities. Strengthening families may be a process that can help in complex situations to bring professionals and family members together to agree on a plan forward to address issues. This is a free service and participation is voluntary. Health professionals and advocates in the disability sector can refer you for the Strengthening Families process. In the following video clips, we will explore education supports.